Hi, I'm Reagan Toole, and this is 60 Minutes In. Today we have invited Olivia Anticoli, an actress who stars in many movies, here to talk about her disease, sickle cell anemia. So Olivia, could you explain what sickle cell anemia really is?
Yes, I absolutely can. Sickle cell anemia is caused by a defect in the offspring's genes, which causes the blood cells in one's body to become misshapen.
And what shape do the cells usually take instead of the normal rounded out shape?
Instead of the normal shape, which is a circle, the blood cell will look like the letter C. This means it is not able to carry oxygen as easily as the normal red blood cell.
So when someone is diagnosed with this disease, what things affect this person's daily life?
Some of the symptoms a person can have is usually joint pain, chest pain, dizziness, fatigue, low oxygen, blood in their urine, an abnormal breakdown of red blood, inflamed fingers or toes, and yellow skin. Chest pain, dizziness, fatigue, low oxygen, blood in their urine, an abnormal breakdown of red blood, inflamed fingers or toes, and yellow skin.
Okay, so do these symptoms happen every day or more so monthly?
It's unlikely that these symptoms could affect someone every day, but it could happen every so often.
How is this defect inherited?
A child has to inherit it from both parents.
I'm Brandon, and I have sickle cell anemia, or SCD. SCD can affect me in many ways, such as stroke, acute chest syndrome, organ damage, blindness, and much more. With just 4 doses of oxymicillin, all of those symptoms can go away. Take your 4 doses throughout 1 month. Go to your local doctor today for your first dose of oxymicillin. Oxymicillin this is what it looks like. And this is a dying patient right here. And then you stab them, and then it should be okay. Hold you.
If a person survives long enough, would they be able to have children in the future?
Yes, with early care and careful monitoring, throughout the pregnancy, a woman with SCD can have a healthy baby. If both parents have SCD, there's a 25% chance of the child having SCD.
Very interesting. Well, before someone is born, can the disease be prevented?
Sickle cell disease can be diagnosed in an unborn baby by sampling some of the fluid in the mother's womb. It gets diagnosed by using a blood test.
Does sickle cell anemia affect any certain types of people?
Well, mostly African Americans are diagnosed with sickle cell anemia, but it could occur in all people.
Are there any famous people with sickle cell anemia?
A jazz musician, Miles Davis, has sickle cell anemia. The blood cells in his body are shaped like a crescent moon. People may also live less in their lives.
Are there any other names for sickle cell anemia?
HBS disease, hemoglobin S disease, SCD, and sickle cell disorder.
Can you cure sickle cell anemia in any way?
Yes, a stem transplant may help, but some medical assistance may be needed, like blood transfusion, and amoxicillin is a newly modeled medicine which takes old blood cells that are affected by SCD.
Great to know. I just saw an ad about that the other day. Some guy was talking about it. Well, anyway, could you tell us some fun facts about HBS disease?
It affects 100,000 Americans, 1 out of every 365 African Americans. It started in Africa about 5,000 years ago. The real discovery of SCD was found in the United States in about 1910.
Thank you so much, Olivia. We had a wonderful time talking with you today. And we learned so much about SCD. And if you have SCD, don't be afraid to talk to your doctor about oxymicillin and stem transplants.
You're very welcome.